Hello, I'm Dr. Grimes. I'm a movement disorder neurologist. I'm a professor at the University of Ottawa and the director of the movement disorder clinic here in Ottawa. Welcome. The Parkinson Canada asked me to try to work through with all of you in terms of how we can try to help sift through all the hordes of data that we're seeing about COVID and specifically, obviously, how it relates to those with Parkinson's disease. I think right off the bat, it's important to realize I am not an infectious disease specialist, and I think it is very important that everyone continue to follow the advice from their local public health authorities as well as the national advice we're hearing. This is something that I think everyone now appreciates is a problem that's moving very quickly, and so far, for many of us in Canada and many areas, we don't seem to be getting overrun by the wave of cases, but we all need to remain diligent and really listen to our public health officials and what the advice they're giving us. Parkinson Canada has supplied me with some initial questions to get our discussion going. The first question is, should people living with Parkinson's go and get the pneumonia vaccine? And this is something that I think everyone who has Parkinson's should be getting that vaccine. I guess the timing right now is probably not optimal, as most physician offices are really trying to see only really emergency cases. I think most of us now appreciate that this COVID pandemic is not going to be going away quickly. And so I think just following what the local advice is as the physician offices start to open up more for non-urgent cases, I think this is something that people should look at getting. Next question was, describe the risk level for people living with Parkinson's. They aren't considered at extreme risk, but what does that mean? And so the extreme risk group in my reading is really those who are immunocompromised or those who have significant breathing problems already. And so the COVID virus seems to be killing people mostly because of breathing problems. So if you have a significant underlying breathing problem, then you would be at higher risk if you were to get this particular infection. So for most people with Parkinson's, they're not at extreme risk. But I think as everyone has seen, as people get older, they are at higher risk. And therefore, just more from an age standpoint, I think people with Parkinson's need to be that much more careful. The next question I received was, should people living with Parkinson's just be social distancing or more strict, i.e. self-isolation? And I think again, I would follow the advice from the public health community saying that, I think we all need to be very conscientious and be practicing social distancing. I don't think that people with Parkinson's need to be, extremely on the far end of following self-isolation, but I think, again, more age-related, as you're getting older, you need to be that much more careful. So one of the next questions was, can a person living with Parkinson's go for walks? And I would absolutely recommend that. That's a good thing. I think none of us can stay inside and be sane for weeks on end. And I think we can all see that this is something that's not going to end next week. And so I think it is important that people still get outside, get some fresh air, obviously with the proper social distancing in place. Can they have family and or home care workers visiting? And I think this too is a bit of a tricky question in terms of, we're all trying to limit the number of people we have contacts with. And so if you have a family member who is out and about and seeing lots of other people, then yes, that might be somebody who you might want to restrict your access to. If, however, your family member is very strict with their social isolation, I think it would be reasonable to have them come and visit, obviously with all the same precautions. I think the issue of home care workers visiting, I think if you need to have somebody helping you out at home, my assumption would be those home care workers would be practicing the proper protective assessments. And now, just in our local hospital, it's been recommended that all healthcare workers now wear masks, in addition to the proper hand washing hygiene for any patient interaction. So I suspect that if you do have a home care worker coming in, that they would likely now be wearing and obviously following the proper hand care and hand washing recommendations. The next question was, what do I do if I need help, but my neurologist has closed office and is no longer seeing patients? This has been a big concern for a lot of people, and I think it's something that's really going to change medicine, obviously now, but also in the future. And I think for most physicians, they're now getting set up with virtual clinics and much more active on phone calls. And in Ontario now, we do have we have the Ontario Telehealth Network, and the Ontario government has done a very good job of getting physicians signed up as fast as they can for those who haven't. Personally, I have been doing some of these OTN assessments now for more than a year. But I think the trouble now is that now you have probably 100 times the number of physicians who are trying to use this network, and so we're running into trouble with it being a little bit more cumbersome. And so the government is in Ontario letting us as physicians do a lot of phone consultations. And so I would recommend that you contact your physician and see what they say in terms of how they're going to be moving forward. But I would suspect that most physicians will be using some sort of either phone or online device because I don't know about each province, but I suspect some provinces may not have as much as a developed telehealth network that I know many physicians around the world are using just things like Zoom and other video conferencing techniques. And so this is, as I said, is changing how we practice medicine. But I think for most patients, they should be able to reach their physicians through some sort of network. The next question, are people living with Parkinson's more at risk for catching COVID-19? And the answer is no. I'm not aware of any evidence that people with Parkinson's disease or other specific neurologic conditions are more at risk than other people. Are any supplements helpful to boost the immune function to combat COVID-19? And the answer there is I really don't think so. I'm not aware of any supplements that have scientifically been shown to make a difference to your immune system. I know there's lots of things on the internet and a lot of things get touted as being, and that's how they work and that's how they get sold is, boosting your immune system. But again, I'm not aware that there's anything from a scientific evidence that's been shown to be helpful. The next question is one that's really raised a lot of controversy over the last few weeks is which cold medications have a negative interaction with Parkinson medications? And I think that relates back to the idea of is there a concern with the COVID-19? And I know there was a couple of weeks ago, there was a report came out suggesting that from the mechanism of how the virus might work, that things like ibuprofen or other anti-inflammatories like that might have change your risk of getting COVID or change how your immune system works with getting COVID. And the answer is no. I think that there really isn't any good scientific evidence that I'm aware of that you have to be any more cautious with using anti-inflammatory medications. In a broader sense, with Parkinson medications, yes, you do have to be a little bit careful, mostly with the MAO-B inhibitors like rasagiline, or the new one called safinamide, and just some of the over-the-counter cold remedies, especially the ones that have DM in them. There's a theoretical risk of getting into trouble. So the question regarding viruses staying on surfaces and how much precaution is necessary, I am definitely not an expert in that. And again, I think it's something we need to keep looking at what our public health officials are telling us. It seems like the virus survives on different surfaces for different lengths of time. I've read things that, in terms of if it sits on cardboard for 3 hours, that then it's not viable after that. On hard surfaces, I think the data is a little less clear in terms of it's a metal surface or hard surface, especially if there's any humidity or dampness to the surface. The virus could survive a lot longer. And I think most people have seen that article that came out about on the ships that they're detecting the virus as many as 17 days out. Again, not clear what that means, and these are special circumstances or not. So I think I would recommend, again, following up with what your public health authorities are. We know it definitely can stay on a surface, and this is why we have to be extra vigilant about washing our hands. If you touch any surfaces that somebody else could have touched, then you should be washing your hands right away before you bring your hands up to anywhere around your face. Those are the questions I've been forwarded so far. There's a couple online here. Claudia from Burlington, what can we as volunteers and Parkinson ambassadors do? I think at this point, as we're sort of in the initial influx, I think it's one of those things where we really should be making sure we're doing our part to self-isolate. I think if you have any people that are close by who, neighbors or things who are, especially if they're older and you feel you can bring them groceries or things like that in just your local environment, I think that would be very much appreciated. But I think at this point, as we're still in the sort of figuring out where we are in the curve, I think, again, we need to be that much more careful and following our own social isolation as recommended. Stephanie from Trenton, she writes, I'm at home recovering from DBS surgery and due to return to work as a developmental service worker. Should I be concerned about the increased risks? And should I even consider at this time? I think this applies to a lot of people with the idea of surgeries in general. I don't think there's any, just because you've had DBS surgery, there's any increased risk of getting the virus itself. But I think just in general of if you are trying to recover from an operation or one operation already, adding another infection on top, it's just going to make the recovery process even that much more difficult. I think in general right now, most work places are trying to keep workers at home and isolating from that standpoint. And so I would hope that your own employer would be looking at ways to keep you at home. And I think most employers in this circumstance are wanting their workforce long term to be healthy. So I would hope you could be able to work with your employer to find ways to work around that. Valerie writes, could getting COVID make Parkinson's symptoms progress faster? Good question. I think that relates to, in general, even if it's not COVID, could another infection change the rate of progression of your Parkinson's? And I think the evidence right now would say no. I don't think that there's any external factors related to infections that we know of that could accelerate the progression of Parkinson's. However, COVID being for many people such a serious infection, I think it would be likely that if you were to get COVID, that your Parkinson's symptoms would likely be worse. You'd have more slowness, more tremor, and just in general, you'd have a harder time with your Parkinson's symptoms. Marion from Regina writes in and saying, is washing your hands really better than using sanitizer? And I think that again, our public health officials are telling us that ideally they want us to be washing our hands with soap and water, and preferably hot water, because it seems like this virus is quite sensitive to hot water. And maybe that relates back to even things like your dishwasher and washing your clothes. The hotter the water, the better it is at cleaning the virus off off whatever you got it on. And so I think that they really want us to wash our hands. And again, it's not the 4-year-old standing in front of the sink and washing for 3 seconds and more getting your hands wet. They really, really good soap, lots of hot water, and stand there and really give them a good wash for the 20 seconds. If that's not available, then it looks like the hand sanitizer is definitely very effective. And for most places you're traveling, obviously it's going to be the hand sanitizer because you don't have a sink around to wash your hands. And so you definitely should be using lots of hand sanitizer. If you have to go out to the grocery store, I think you should be carrying some with you. And every time you touch a foreign surface, be putting some more hand sanitizer on it. I've certainly been hearing very encouraging things from here in our local grocery stores in Ottawa, that they're getting more and more vigilant about how they're cleaning the carts as you walk in, how they're making sure that all their surfaces are regularly cleaned. And so I think we're all doing a better job from that standpoint. The next question from Alana from Hamilton: do we know how this would affect someone with Parkinson's, since this is more of a respiratory issue? And I think, again, maybe ties back to what I was just saying, that it's likely would make your Parkinson's symptoms and all your Parkinson's symptoms worse. And so you would likely notice, as I said, more tremor, more slowness of movement, but that would be temporary. And so that as you recover from the infection, your Parkinson's symptoms should go back to the way they would before. I think, as most of you know, that the recovery from almost any illness when you have Parkinson's can be slower. And so I think the expectation of kind of getting fully back to your usual previous health might take you a little bit longer, but the expectation would be that you would be able to do that. Moira, any concerns about the supply of Parkinson medication? I think for all of us, it's been a real frustration over the last couple of years as we keep seeing the supply chain for many different Parkinson medications, for some reason, getting interrupted. And I think for a lot of people, we really struggled with the amantadine for a long time. We struggled more recently with the entacapone, Stalevo. But as far as I know, right now, in Canada, I think all the Parkinson medications are fine. I'm not aware that the COVID has had any effect on the supply of Parkinson medications in Canada at this point. And so there shouldn't be any issue. I think, just trying to limit, getting out of the house, I think it would make sense of trying to, pick up at least, a couple of months medication at a time, if that's possible, versus, going 1 month at a time, again, sort of limiting our contact with going into more public areas. Alana from Hamilton has another question: how do we keep a person with Parkinson's active while being stuck in the house? I think, yes, a good question. And I think it's something that everyone is struggling with feeling as the days and weeks progress, and likely into months, that we're all going to feel a little bit more cagey being at home. But I think, again, it's an opportunity maybe to be a little bit more inventive with exercise. I think we've all seen some of those funny videos online where there's an Italian on his bicycle biking in circles around in his apartment, in and out of a hallway and into his kitchen. That may be taking it to the extreme. But I think, certainly if you have any exercise equipment at home, stationary bicycle, a treadmill, certainly that's a very good alternative. There's lots and lots of online exercise videos. I've seen my wife and children now in front following YouTube exercise workouts. And so I think that's a great resource. Parkinson Canada has resources as well about home activity on their website. So I'd certainly encourage you to look at theirs. As I mentioned earlier, I think you still need to get outside. And so despite, the concern, I think that none of us can spend weeks, certainly in our own apartments or in our own houses, not get any fresh air. So I think, following the proper sort of social distancing, I think, getting out and getting some fresh air at least a couple times a day is still a good idea. Janine from Saskatoon, do you think our Parkinson's symptoms could feel worse from isolation, even without Parkinson's? I'm not sure I quite understand the question, but I guess the even without, I guess the question more relates to is, just the isolation itself, could that make your Parkinson's symptoms worse? I think as for many people, staying inside and not having the usual social contacts that we have, maybe not seeing children or grandchildren as much, that I think does increase sort of anxiety levels, and the whole COVID thing is definitely more stressful. So I could see just our overall situation and being kind of a little bit more confined, that is stressful, and we know that could make your Parkinson's symptoms worse. I would encourage people. I think everyone's seen those videos of doing kind of Facebook or Zoom conferencing with grandkids and reading them books and using the internet to its full capability of interacting with our loved ones. So I think I would certainly encourage that kind of thing. Carolyn asks, have there been any reports of people with Parkinson's dying of COVID? And so as far as I'm aware, I've not heard of any COVID positive patients. Parkinson's, I'm sure there will be. Again, I think that there will be, because there's so many people who are going to be affected by this. Again, I don't know of any data that suggests that there's any increased risk from your Parkinson's itself from dying if you were to get COVID. I think so far the data suggests it's more age related. I think if you're having more mobility troubles and you were to get a pneumonia in general, whether it's COVID or not, that would put you at higher risk. If from your Parkinson's you're having more difficulty from a mobility standpoint. So again, I think that again stresses the importance of trying to get outside and be active. Jerry from Red Lake, after coming back from shopping, is it wise to wipe down all contact points with sanitary wipes, like the car and household surfaces? Again, a good question. I think that this idea of, when you have to go out and you have to buy, your medications, or you have to buy critical supplies, obviously food, what should you do when you bring that back home? There was actually a very nice video that I saw. A family physician from, I think, Michigan posted this online, a really nice YouTube video about what you should think about doing to clean your food, or how if somebody drops off, if you order in food, what you should do. And I thought it was a very practical video, and maybe I'll get Parkinson Canada to see if they can find it. But it was a very nice demonstration of making sure, because you can't be sure what the person who passed you, whatever, or the grocery store got COVID off the box properly. I think to be extra prudent, especially in this time, really watching out for any surfaces that somebody else could have touched, and how to properly manage that once it comes into your house. So I would encourage you to look online, and I suspect if you Google, Michigan family physician and COVID and groceries, that you would be able to find this YouTube video. Stephanie says, knowing that people with Parkinson's suffer from depression and are now having to self-isolate, what would you recommend to help cope? Again, I think the Parkinson Canada has a nice segment on their website where they try to give people ideas of how to, help with our coping mechanisms in these more stressful times. And as I mentioned earlier, I think, again, getting creative. There's lots of things online. I have one of my nieces. She's joined an art class, and so every day she produces a work of art that all her relatives will then bid on in terms of different things they'll do for her paintings. And so I think, again, using the internet to its full beneficial capacity is going to help with that feeling of isolation. Again, the idea of getting outside and again doing what we can to although keep social distancing, still keeping in contact with other people. Lauren from Ottawa, how can I get a prescription refill? I think, again, it's a good question. I'm not sure if, Lauren, you're one of my patients, and I just signed your prescription to get your prescription back to you. I think people need to realize that most physician offices now are functioning in a very different way. And so the hospital recommends, my office actually is in the hospital, and they recommended that all healthcare professionals, if they don't have to come to the hospital, don't come to the hospital. And so I'm now only coming into the hospital once or twice a week. And therefore, the prescription refill process is going to be slower. There is the option of trying to phone in some prescriptions if it's an absolute emergency. But I think most pharmacies should be understanding of this, that it is going to take a little bit more time to get the prescriptions back to people. Certainly, I was hoping that our own electronic medical records would be set up so that we could just press the button and it would go immediately to the pharmacy. And I know our hospital is working on that. So I know some people that may be an option for their physician to just immediately sort of email it to the pharmacy. So again, you should be able to contact your physician offices. The messages for most physician offices should be being answered. It's unfortunately the whole process is going to be a little bit slower to get it back to people. So there's a few more personal medical issues, and so I guess questions around that. So Darlene asks, are people with Parkinson's at higher risk than others for COVID? I mentioned this earlier on. I'm not aware that that's true. And so again, I think that with the ease of which COVID seems to infect people, at this point, I'm not aware that there's any more higher risk for any certain group to actually get the virus. Certainly, once you have the virus, if you're immunosuppressed, it puts you at higher risk for getting into more trouble once you actually have the infection. So again, we need to be that much more cautious about social distancing if you are immunosuppressed. But people with Parkinson's aren't immunosuppressed, and the medications we use to treat Parkinson's are not ones that cause immunosuppression. And that's different than some other neurologic conditions where the treatments themselves may cause you to be immunosuppressed. But fortunately, again, for Parkinson's, that's not the case. Are there any conditions that can be exacerbated with Parkinson's and the virus? I don't think I understand the question fully. Yeah, I'm not sure. Again, I don't know. From a neurologic standpoint, the neurologic complications of COVID are still, I think, in the infancy. I've seen some more recent reports that people with COVID who are COVID positive, they might be at high risk for other things like developing strokes. I'm not aware that if you develop a COVID infection that you would be increased risk of developing Parkinson's down the road. There has been some concern with, the Spanish flu from 100 years ago that people down the road might have developed Parkinson-like condition from that infection, but this is way too early to know for that COVID does anything to our brains from a longer-term standpoint. So Paul from New Brunswick says, my wife and I wrote out a daily schedule to break up the day. I think that's a fantastic idea. And so again, the idea of trying to develop some routines in your day, I think, is a good way to try to pass the time with your day. And so, it can be as simple as, okay, I'm going to walk the dog at this time, or I'm going to interact with a person at this time. We're going to do this together at this time. And so, again, I think a schedule is a great idea. So, it can be as simple as, okay, I'm going to walk the dog at this time, or we're going to do this together at this time. So, again, a schedule is a great idea. I'm hearing some vague talking in the background. I hear that's the end of the questions. I guess at this point, I just, again, would like to reinforce everyone to be safe, but still important to try to be active and try to not isolate yourself in a virtual sense from everyone else.